It's time for Health Check with Heidi Godman, a daily dose of health and wellness information. Call or text Heidi your questions at 373-1220. That's 373-1220. And now here's Heidi Godman.
Hi, everybody. Welcome to Health Check. I'm Heidi Godman. Hope you're doing well on this great day. We have a very interesting program for you today, just full of health and wellness topics. In a little bit, it'll be time for our weekly brain boost with my great friend, neurologist Dr. Dean Sutherland. We're going to be talking about brain health today with Dean. Now, it's our weekly brain boost, but we're going to be talking about something that has perplexed people for a long time. People with cancer sometimes have cognitive problems, sometimes problems with their thinking skills. And for a long time, we've thought that, well, it's because of chemotherapy. Dean says that may not be the case. It may be that cancer is causing the thinking skills decline, not the chemo. So he's going to be here with us in a little bit, and we will talk to him about that. We will also be talking today about the change in weather and how it affects your skin. So when you go from cold weather to hot weather or hot weather to cold weather, here in our area today, I mean, it's in the 80s, but it feels like in the 90s. And this is November, and we are still going through this. And you know what's coming. Cold weather is coming. And so suddenly, when we go to that, how is your skin going to react? And then, you know, once we get to the springtime and suddenly we go from cold weather one day to hot and boiling weather the next, how does your skin cope with that? So we'll find out about that and what you can do to prevent any problems. But we are going to start today by talking about age-related hair thinning in women. So this is something that women do not like to talk about at all, but women experience hair loss and hair thinning just like men do. You see it more obviously in men. It's very, very hard for women to talk about hair loss, it seems, and I think that's probably a result of our society, if I'm injecting my opinion here, and I am. And I know that also because I've done lots and lots of stories about hair thinning and hair loss over the years, and anytime we would speak with a doctor and try to then interview a female patient, we never could find anyone in television, anyway, who would want to go on the air and talk about it, and certainly you can understand why. So we are going to find out about this problem and how many women it affects, and what are the symptoms, and what are the causes, and what can we do about it, and that is the most important thing. So we've invited just an absolutely wonderful dermatologist here on the program, Dr. Manjula Jegasothy. We've talked to her lots of times before, and she's just an absolute expert, great for cosmetic issues, but also just brilliant when it comes to all kinds of health issues that relate to the skin. So welcome, Dr. Manjula Jegasothy. So glad you're with us. And we have lost Dr. Manjula Jegasothy, so we will get her back on the phone with us in just a second. But I can tell you a little bit about hair thinning myself because I don't experience it, and I'm very grateful for that. But I do have members of my family, some cousins, who have gone through it, and that is, it's a very upsetting thing for women to go through this. You know, we're supposed to have this fabulous flowing hair. We're supposed to have a certain particular look, whether you have long hair, whether you have short hair. And if you are unable to maintain that, then that could be very frustrating. It can be very damaging to your self-esteem. And of course, you know, hair is not important in the big picture. But if it does affect your self-esteem and you're out there thinking, oh, I have this thinning patch of hair, or if you're thinking anything like that, then this might be a topic that you definitely want to tune into. So we are going to go back to Manjula Jegasothy now. Manjula, are you there?
Yes, I am. Thank you so much for having me again on your show.
I'm glad you're here. We lost you for a second there, so I'm glad you're back. So tell us a little bit about hair thinning in women. Is it as common in women as it is in men?
Yes, it's so interesting because I think we commonly think of men as balding as they get older, and we don't really realize that women lose hair, or the percentage of women who lose hair throughout life is just as great as men. It's just that they don't lose it in large patches. It sort of thins throughout the scalp. So it just manifests as hair thinning over the entire lifetime rather than actual balding like it does in men.
Now, why is that? I mean, what's the big difference there gender-wise?
In one word, testosterone.
Oh, okay.
So the thing that causes balding or patchy hair loss in men, which is age-related, is testosterone. As you get older, the testosterone actually physically miniaturizes the hair follicles on the head in genetically susceptible men. But in women, what it does is it miniaturizes the hair follicles just here and there. So that's why there's thinning, but there's no actual frank balding.
Well, let me ask you this then. Crazy question. Women who change genders and transition into men, do they then, if they're taking testosterone, do they suddenly experience hair loss?
We haven't done studies in that cohort of people, and a lot of them tend to do hair extensions and things like that. So it's not really known. You know, I think that with gender reassignment, there are so many other issues going on hormonally that I think the hair loss is sort of the least of it.
Yeah, that's just a tiny part. I don't know. That was just a crazy question I had. But you know, some women are on hormone replacement that does include testosterone. So is hair thinning or actual hair loss a problem in that case? Is that something you would need to be aware of?
Particularly, and what's really important here in women is the estrogen to testosterone ratio. And so obviously when we're young, that ratio is very high. There's a lot of estrogen and minimal amounts of circulating testosterone. Actually, you know, when you're young, you have high levels of both, but much higher levels of estrogen. As you get older, those estrogen levels drop, and actually the testosterone levels kind of stay the same or go slightly down, but the ratio then really drops. And that's what causes the thinning in women.
Is there a particular age or a decade where this begins?
And that's very genetically predisposed. I see women who experience, you know, extreme thinning in their 30s. It may start with a pregnancy or something like that, or weight loss, or some kind of surgery or trauma, and then they never really get it back. And then there's some women or most women, I think, really lose it, just sort of start losing and continue to thin premenopausally and then throughout menopause.
Mm-hmm. And then how common is it? I mean, are we talking 50% of women, or, I mean, how many do you see?
I'd say we're talking more than 50%. I'd say we're talking about 60% of women. I don't know very many women. If you think to your own relatives or your own female relatives, and this is on both sides of your family, if you think to them, do they in their 70s have the same head of hair that they had in their 20s?
Mm-hmm.
The answer is usually no.
Right.
So I think it's much more prevalent than we really realize.
Sure. I was talking in those couple of seconds where we lost you at the beginning of the program. I was talking about the fact that I have some family members, some cousins, who have struggled with hair loss. And what it does to self-esteem is just so heartbreaking. Tell us a little bit about what you have noticed among your patients.
Absolutely. I think that particularly, nowadays, women are trying to keep their hair longer as we get older, and that part of that is because hair dyes have gotten better. You can maintain a nice head of good-looking colored hair for a longer period of time. Social mores and standards have changed, so it's acceptable for a woman who's 60 to have, shoulder length or longer hair. Living in Miami, a lot of older women have longer hair. So if your hair is thinning when it's longer, it's even more noticeable, which is, I think, a primary reason that women do cut their hair as they get older anyways, because their hair is thinning, and so they don't want it to be quite so obvious.
Mm-hmm. No, I have to say that my own mom had just a giant ton of hair. Now she's 86, and she has a covering of hair, a nice little covering of hair for an 86-year-old. She doesn't look like she has bald patches anywhere, but it's much thinner. So is that what I should anticipate as I get older?
Well, again, you said the key phrase there. You said she has a nice head of hair for an 86-year-old. That's the thing, is that we almost expect that you're going to lose hair as you get older, and nobody really delves into why that is, or should that have to be the case. You know what I mean? And so the answer to your question about you is no, it doesn't have to be that way. If you take some measures now to maintain your scalp health and keep your hair, follicles healthy.
Mm-hmm. Okay, and we're going to want to find out all about what we need to do in order to keep a great, healthy head of hair our whole lives. But let's talk about the different types of hair thinning or hair loss that women experience. And let's go all the way to the extreme and talk about alopecia. Tell us about that.
Okay, so alopecia is defined by patchy hair loss, and most commonly it occurs in children or young people, and it's still more men than women. I think 2-to-1 is the ratio of men to women, and that's defined mostly, it's considered an autoimmune condition, much like thyroiditis or even lupus or any of those things. It's considered an autoimmune condition where your immune system attacks your own hair follicles in patches, and so you get patchy falling out of the hair. And again, it's predominantly in people under the age of 30.
Mm-hmm. And then there are a couple of types of alopecia, aren't there?
Right. There's many types. There's about 4. So there's alopecia areata, which is the most common one, which is just in the scalp. Then there's totalis, which is the scalp and facial hair. So eyelids, eyelashes, eyebrows, facial hair, beard hair in men. And then there's something called universalis, which is all body hair.
Mm-hmm. All right. And so the common type of hair thinning or hair loss that you see, what is that called?
The most common type, we call it androgenic alopecia, which again refers to that term. Androgenic is the testosterone factor. And that's the reason and we call it that in both men and women medically.
Oh, all right. And then there's also a temporary hair loss that can occur after pregnancy and times like that.
Homework. That's called telogen effluvium. It has a long name. And what that means is, as I mentioned, I alluded to earlier, in younger women who go through some sort of trauma, like a surgery or even pregnancy and labor or extreme weight loss, what that does is it kind of shocks the hair follicles into all going into what we call the telogen phase, where they don't grow. That's the phase where our hair cycle is in 3 phases: anagen, catagen, and telogen. Anagen is when it grows. Catagen is when it's falling out, and telogen is when it's just static shocked into place. And so all of them go into telogen at one time, and then a month or 2 later they go into catagen and all fall out. And that's what you were talking about when you have that sudden hair loss.
All right. And the good news is that there is a lot we can do about hair loss or hair thinning in women. And we want to find out, but we're going to take a quick break. So everybody, please stick around. More with Dr. Manjula Jegasothy, who is also the founder of the Miami Skin Institute and just a thumping good cosmetic dermatologist. You are listening to Health Check with Heidi Godman on WSRQ. More in just a minute. Welcome back to Health Check. I'm Heidi Godman. You are listening to a show all about hair loss in women today. That is our topic at the moment. And my guest is Dr. Manjula Jegasothy. She is the founder of the Miami Skin Institute. She's an Ivy League trained dermatologist, cosmetic dermatologist, and she's been telling us about the problem of hair thinning in women. It's very common. She says it's so common. She sees it in about 60% of her older patients. So we are going to find out now. She just told us about the different types of hair thinning and hair loss in women, but we're going to find out now what we can do about it, because I think that's what everybody wants to know. And Manjula, I would think that the first step you would need to undertake is a visit to your primary care physician to find out if there's an underlying cause behind your hair loss. Is that right?
Absolutely. In fact, I advocate everybody over the age of 35 to go to a suitable gynecologist, meaning a gynecologist who specializes in premenopausal, perimenopausal, and menopausal issues. That's usually somebody who doesn't deal with just routine pap smears or does OB-GYN, or so they don't deliver babies either. There's a lot of specialists that just do this. And for women over 35, that should be your primary doctor. And you should get a panel of full hormonal testing and nutrient and vitamin testing. If not yearly, maybe once in 2 years, something like that.
All right. But if you're in your 50s and you haven't had it done yet, you might want to go ahead and do that. Now, what about the people who say, oh, that's sort of, voodoo medicine. You're spending a lot of money. You don't need to do that. Now, you're Harvard and Yale trained. So what do you think of that?
I absolutely thought, I've been trained obviously in the Western medicine school of thought where if there's no abnormality in the lab work, meaning it's within the range of normal, then it's fine. We don't treat. You know what I mean? And, for a long time, the thinking was if you take a multivitamin, you're really just, you're basically creating expensive urine. You're not going to really, get any benefit of it. It's not going to be absorbed. But the latest thinking, particularly in the endocrinology literature, is that if you have actual mild variances or mild deficiencies in any of these things, which actually fluctuate from year to year, which is why it's important to get it checked yearly, is that if it's supplemented, then you can actually enjoy a much better life and health well into your 70s and 80s, and it may even prolong life.
Okay, so that is a very interesting thing. Now, if you did go and get one of these panels, would any vitamin deficiency be behind hair thinning or hair loss? Or, certainly thyroid issues could be behind it. What else?
The two most common sort of systemic reasons for hair loss are, as you mentioned, the thyroid, and then if there's liver abnormalities. And so that would be seen on a liver function test. So we check those first. We also check, if someone is experiencing profound hair loss and there's no reason for it, we always check a lupus panel also, just because that's another thing that doctors don't want to miss in case that's the first sign of lupus. But after that, then, there's minor deficiencies in B12 in many of us, who are healthy. If you drink, more than 2 or 3 glasses of wine frequently in the week, that can cause a mild B12 deficiency. And so if all of those things are supplemented, then, it really does improve your hair growth and your overall health.
Okay. All right. So then let's find out what else we can actually do. Maybe you have to treat an underlying cause of hair loss. But if there is no obvious underlying cause, or even if you're treating it, but you're still experiencing hair thinning or hair loss, what can we do to stop it?
This is the first time that there's been data for an actual procedure other than hair transplantation, which actually really works in terms of growing hair, and that's PRP. And I think we've talked about PRP in some of my broadcasts earlier, Heidi, yes?
Yeah, I think so, but let's tell everybody in case someone's just tuning in. Now, Manjula is talking about platelet-rich plasma. And I've observed this particular procedure when I reported on it years ago, and I actually saw, to me, it seemed like you were taking the platelet-rich plasma from someone's blood and then aerating the scalp, almost like you would aerate your lawn, and then putting the platelet-rich plasma into those little perforations in the scalp, and it seemed like Miracle-Gro. And the patient I interviewed really had some results. Am I summing it up well?
Yes. That's pretty much it. You don't have to really aerate the scalp. All you have to do is really just inject into it.
All right. So you would withdraw some blood from a person, use the centrifuge to get the platelet-rich plasma, and then you inject it in places. How does that help?
So what happens is when you actually take blood from a person, the doctor spins down the blood so that those platelets are broken open and the growth factors come out of the blood. Come out of the cells into the plasma, and then the doctor just injects it, and it's become standard of care in orthopedics and podiatry, post-transplant, post-knee replacement, post-hip replacement to really rehab the joint better and make it better. So now we're doing it, for example, in cosmetics to make the skin texture and tone better. Growth factors just help the hair follicles, so that's what we do is we just take the blood, spin it down, take the growth factors out, and just inject it into the scalp. You don't need to aerate it or create pockets like you do for transplantation.
All right. And then what kind of results do you get?
The results are, I think it's about, right now, they're showing, about a 40 to 50% hair growth in about 70 to 80% of treated subjects.
Terrific. And it's only as long as you keep getting the treatments. Once you stop, then you're out of luck.
Yes. That's right. I think that the results, the growth factors generally, when injected into the skin, persist for around 7 to 10 months. So you're going to get results for about a year. So
Terrific.
Most people who do it are so happy, they're happy to repeat it yearly.
Terrific. Do you do that for your patients?
Yes, I do.
You do. All right. And then what about the shampoos? Or what about, you see some of those supplements that are specifically for hair thinning?
The supplements that are for hair thinning?
To prevent it or to stop it, supplements.
The supplements are biotin and thiamine are mostly the best supplements, and they work very well for that kind of hair thinning. Essentially, what they do is most people have minor deficiencies in them, and there's a new company that's packaged it, so it's very well packaged and actually does a lot better.
All right. And then what about some of those shampoos that we see that promise
I don't think shampoos really grow hair because it's what we call short contact therapy.
So, I mean, we're talking about things like Rogaine and things like that?
Yes. Rogaine does help the hair follicle become less small, but I'm not sure that, as you might have seen the data, it shows that it maybe grows hair in 10% of people. So that's been always the issue with Rogaine. It's great to kind of keep the hair you have.
Okay, and so what about women whose moms have, like my mom has a lot less hair than she did when she was younger? Should I turn to something like this? I mean, my hair is great right now, but what if I want to keep it this way?
I think it's a great way to prevent.
Okay. All right. Terrific. Well, we are going to continue speaking with Dr. Manjula Jegasothy, but we need to take a quick break. In the meantime, if you want to check her out, she's the founder of the Miami Skin Institute. And what's that website?
It's www.miamiskininstitute.com.
Terrific. All right. Stay with us more with Dr. Manjula Jegasothy, an Ivy League trained cosmetic dermatologist, in just a minute. Stay with us. Welcome back to Health Check. I'm Heidi Godman. We are speaking today with Dr. Manjula Jegasothy. She's a Harvard and Yale trained cosmetic dermatologist. And in our last couple of segments, we were talking about hair thinning in women. There's a lot that you can do, and I encourage you to check out Manjula's website or her blog if you're interested in that. She's the founder of the Miami Skin Institute, miamiskininstitute.com. And Manjula, tell us a little bit about your blog, because it's really great.
Thank you so much, Heidi. We try hard every week to put out some really good content based on sort of what I see as timely, and people are asking me questions in the office, but also, what's in the magazines, and then the latest treatments. And I just started a podcast channel, which features a lot of all of our radio shows, and it's received a lot of good attention.
Yeah, that's fabulous. How do we find out about these things? How do we go to your podcast channel? How do we check out your blog?
So for the podcast channel, the platform is Podomatic.com.
Podomatic.
Search and it's a great vehicle for even if you want to do YouTube uploads and things like that. It's got great search engine visibility, so it's easy to find. And you just you can search either Heidi Godman or Miami Skin Institute, and it comes right up.
Okay, terrific. Okay, and then tell us about your blog.
The blog is on WordPress, and again, you can just go to wordpress.com and search Miami Skin Institute, and it comes up right away.
Okay, terrific. And I know you have so much great stuff on there, and you're one of the most media-savvy docs I talk to, and that's very impressive because you don't get training for that in school. You don't get any special instruction in how to deal with that when you're training to become a doctor. And then when you are a doctor, there's so much that you're trying to do just to treat your patients. I'm so impressed when docs are able to then forge ahead with technology and really just not just technology to treat their patients, but also to keep up with everything that's going on around us. So really cool.
Thank you so much. I've always really loved the media. I was editor-in-chief in my high school and college papers, and so
it shows. And you're great to talk to too, and a great doctor. So we want to talk now a little bit about skin health. You are a cosmetic dermatologist, and something that you and I were talking about before the program, and we were trying to figure out what to talk about is the change in weather and how that affects our skin. So tell us a little bit about that, because I think when we go from cold to hot weather or hot to cold weather, there are different changes. And what happens?
Yes, the main thing is just the act of traveling. People need to realize either being in an airplane. I always say, the being in an airplane and being in that air for an extended period of time, cabin air, is recycled. That's why we all get sick when we go on the airplane for a long time. So you have to protect your skin. So it's always good to take cortisone 10 along when you travel, even when you're oily or dry. Either way, people always get mild rashes or just extreme dryness after flying.
Yeah, I did. I have to tell you, I just went to Washington, D.C. for a medical conference, and I got back, and suddenly I realized I had very dry skin on my face. My lips were chapped, and it was cool up in the Washington, D.C. area, but it wasn't freezing or anything. So what is it? What is it about
traveling?
Yeah, it's the act of travel, the being on the plane. Is that it? Just for a couple of hours, it dries out your skin that much?
Absolutely. Remember, you're breathing and being in recycled air. And so that air doesn't have not only the humidity or moisture content, it has, I hate to say it, it has all the sort of viral things and impurities that everybody else is breathing. So, and that affects, I believe, the immune system of the skin, and that's why people get colds. So it affects the immune system in your upper respiratory tract and everything. So a little cortisone 10 on a over-the-counter that you just buy at a drugstore goes a long way to fixing all those kinds of dryness and when you land the next day kind of rashes.
Is there anything you can do beforehand to prevent that?
I haven't found that.
Okay.
I've been looking for 20 years, and every time I fly, I have to just take my travel kit of things. And my travel kit is, the cortisone 10 for my face. Even though I have acne, it basically makes it a lot better. And then I always take a good pimple medicine because for some reason it stimulates the immune system to cause cystic pimples in people who are prone to that. And then, as you mentioned, the lip chapping. It's got to be an autoimmune thing. We don't exactly know what. But again, to use a good lip balm with preferably a little bit of cortisone in it would be great.
Okay. Now, let's say that you're traveling from a nice warm place like Florida to go skiing, and it's very cold where you're going. What can we anticipate? Even more dryness?
Yes, so and also remember skiing, especially the wind is a chapping factor that people don't take into account. And then there's also, you're just as high risk for sunburn, especially in a high altitude climate with, where the ozone is a little bit thinner. So, make sure you're really hydrated, your skin is really hydrated, and that you've got a really good zinc-based sunscreen on board every day that you're outside.
All right. Very interesting for that. And then let's take the opposite view. If you are in a cold place and you're coming here to Florida to visit people, what would you need to do to protect your skin?
I particularly like this topic because I thought, it's a timely one for all the snowbirds that are coming down here right now this time of year. When you go from a cold place to a warm place, I think the thing I see most frequently is that people who have never been prone to acne, and even people who thought that they were too old for acne, get acne when they come down here after being up north all summer. Mm-hmm. So be prepared with, a little bit of Oxy-10 over the counter or Stridex pads for the first week or so after you come down. And also, just be prepared for a good facial hygiene. Carry around some good facial wipes. You're going to be sweating more until your body acclimatizes to the new weather, that kind of thing. I mean, I don't know about you, but it's 92 degrees here in Miami right now. So, I think people don't expect it to be that hot going into December.
Yeah, it's very warm. It's in the 80s, but because it's so humid, it feels like it's in the 90s. The feels like today, I don't know, I think it was 92 or 3. So what about that if we just live here year round and then suddenly we go through a cold snap? How do we deal with that?
So a lot of that is related to the sudden dryness and the cold snap. Sometimes we have cold snaps that actually are still very humid. And so then that's often the worst kind of situation because that's a setup for superficial fungal infections of the skin and things like that. So you need to be very careful at the gym and at the pool. You need to, make sure you wear, flip-flops or slippers. And, when you hand sanitizer after you use gym equipment, don't use wet towels, that kind of thing. So any kind of moist, cool environment is a good one for skin fungus. And so just make sure you prevent it against that. And then obviously hygiene for the sweating because most heat rashes are caused by occlusion of the follicles or the pores from sweat. So make sure you wash, as frequently as after you sweat, or you carry around wipes after the gym. Don't sit around in your sweaty gym clothes. Don't sweat, after you've been taking care of your yard for the first time. When you come down, make sure that you shower immediately after or have some wipes on hand.
Mm-hmm. And then tell us about skin protection from the sun here in Florida. What should we be wearing every day? And especially if you do have oily skin to begin with, how can you wear sunscreen that isn't going to make you break out?
If you do actually break out a lot, it's very hard to find sunscreen that doesn't promote that. So I tell people sun avoidance is best. If you have to be outside, a hat and sunglasses, and, a very light sunscreen, something like Neutrogena Dry is a very good sunscreen for acne-prone people. I sell one in the office that's an anti-aging lotion that's very light. It's called Regenica, which has a sunscreen in it, which is a rare thing to find a good anti-aging product that has a sunscreen built in without having to add extra sunscreen. But that's a difficult problem if you tend to have oily skin. If you tend to have dry skin, sunscreen is great because it hydrates it. Lots of them now have a little iridescence in them, so it makes your skin glow a little bit. So if you have dry skin, it's great to come down here in the winter.
Yeah. And then what does the humidity do for us if we live here? I mean, there's got to be some benefit.
Absolutely. I think there's an inherent anti-wrinkle process in humidity because it hydrates the top layers of the skin, thereby minimizing fine lines that are superficial on the skin.
All right. Well, I'm so glad to know that, and we can all be grateful. Something else to be grateful for.
Everyone likes to come down here, right?
Yeah.
People of a certain age, that's why they all live here in the winter.
Yeah, absolutely.
Lots of benefits.
Well, Manjula Jegasothy, always so much fun to talk to you. I sure appreciate it. And tell us again about all of your different media outlets where you're posting and where we can learn more.
Thank you so much. Absolutely. And I love doing these shows. And please find my shows with Heidi Godman on my Podomatic channel at Miami Skin Institute. And then also you can find me on the web at MiamiSkinInstitute.com. On Facebook, search Miami Skin Institute. And then I have a Twitter feed that I do every day, and the handle is at Miami Skin In.
All right. Fabulous. Great talking to you, Manjula. Take care.
Thank you.
All right. Thank you so much. All right, we are going to take a quick break. While we're in the break, if you want to check her out, just go to Podomatic and you can listen to any of our podcasts again, or go to MiamiSkinInstitute.com. I'm sure they have all the links there too. And you can check out more about Dr. Manjula Jegasothy. Just brilliant. All right, that's it for this moment. I'm Heidi Godman. You're listening to Health Check with Heidi Godman on WSRQ. When we come back, it'll be time for our weekly Brain Boost. Stay with us.